Feral Pagans presents Understanding Autism, a guide for first responders with Liané Mitchell, CEO of Feral Pagans, certified flight medic.
So my name is Liané. I'm a flight paramedic. I worked here in Lyon County, Trigg County, flew with Air back for 3 years, work Vanderbilt Life Flight now. This is something that I have been doing for the last year and a half in the making. When we first did this last year, I told Michael the next one we do, I would really love to do a thing about autistic patients, because I really felt like, in my own experience, this was an area that, as a whole, as first responders, that we were weak in. Other than the stigma, can anybody raise their hand and actually tell me what autism is? Anybody know? I'll make y'all do jumping jacks. I don't care. Like, don't need to be more lively. I know I'm last, but they say the best for last. Well, I don't read verbatim, so y'all can read. It's not that you can, I think. But this is what we're going to be going over. Different dynamics, what it is, breaking some of the stigma. We're going to understand it's autism spectrum disorder. Basically a neurodevelopmental condition that you were born with, and it's not a cookie cutter one size fits all. So they have changed things over the years the more they understand it, from the DSM-V-TR, excuse me, is the newest one. I brought my boyfriend Joe here. He's a licensed clinical therapist, specializes in autism and ADHD, so he's gonna make sure I don't mess anything up.
I don't know nothing.
This is his realm. I treat the physical stuff. He treats the mental stuff, which is, my old pilot told me I needed a live-in therapist, and that's why he's with me. We're just his dissertation with my ADHD and my kid's autism.
It's true.
All right. So why this is important? It's always been around, but it's a lot more prevalent. People are learning a lot more about it now. It's coming more to light than it used to be. Same thing with ADHD. We always knew, like, ADHD, autism, it was a thing. But, in the 90s, you just whoop them hard enough. If you're going to whoop the ADHD out of them, nothing actually. Proof of experience. We just do it more sneakily. So, just in Kentucky alone, 82,000 people are diagnosed with autism. That's just the one that we know. And it's important because eventually these people will need emergency assistance. And knowing a lot of autistic patients have other comorbidities, and we'll get to that in a second. But to give you a brief summary, this is the difference between with the DSM-IV versus the 5 and the new TR. But to give you some insight, these are a few things that you may run into patients and hear, they have, my kid or adult child, more or less, has Asperger's syndrome or Cancer syndrome. These are different terms that were separated before they made it a spectrum, if that makes sense. The only difference, really, with the DSM-V and the TR, just because they didn't want to write a whole new book, is that they used to say, once you're an adult, the autism goes away. You're better, you're cured, your brain's fully developed, you no longer have it. And studies show that's not true. It's a lifelong disorder. As we get older, with more therapy options and things, people can cope better. They have a lot of good resources with speech and ADA therapies, things like that. But it never goes away. It's not a curable thing. It's just what you're born with. It's literally how your brain's wired. Before, they had 3 domain symptoms: social interaction, communication deficit, and restrictive or repetitive behaviors. After 2013, when the new one was written, they simplified it into 2 domains: your social communication and your repetitive restrictive behavior. The severity of levels, like I said, they changed it to a spectrum. So we have levels 1, 2, and 3, which is mild, moderate, severe. To take in context, if you hear somebody say Asperger's or high functioning autism, that's what level 1 is. Basically, they might need a little bit of help, but they pretty much can live on their own and manage. And level 3 being the worst, as even as an adult, they will always need care. They will not be able to live on their own a functional life without moderate assistance. Before, the symptoms had to appear before the age of 3, and now we acknowledge that it may be after that. A lot of parents, especially if this is their first child, won't realize that their child may potentially have autism until they start school, between the ages of 3 and 5. And that is because, little Timmy's not acting like the other kids. He's weird. We're all a little weird. But that's what they say. They're weird. They do this weird thing with their hands. And then that's when they're like, maybe they should be tested. And that's how a lot of families end up finding out about autism. Can anybody tell me what stimming is? Anybody? Well, we all do it.
It's something that calms them.
Mm-hmm. It's a repetitive behavior. So it's tapping your foot over and over again, tapping your pen. You don't have to be autistic, just know. I do it all the time. I'm sitting here holding a rock right now because it's soothing. Because it helps my brain focus on what I need to focus on without scrolling out, despite being on medication. So it is a comfort for them. Most of them do not even realize they're doing it. It is in the aspect of anatomy, because I'm very I want to know physiologically what's actually going on. You can do behavior all day long. That's his realm. That's not my realm. Hey, they're acting up. I don't know why. But what is going on in their brain that actually causes that? So the basal ganglia in your brain is responsible for that motor function, that repetitive and social cues. So they believe that there's something that is wrong with the basal ganglia that causes this. And to people with autism, it's no different than breathing. They're constantly, this is how they stim. And there's many different forms of stimming. Some people do hand flapping. My 5-year-old, she's diagnosed level 3. Realistically, she's more level 2. She has autism, which is another reason I really got into this. She will scream because she can. She will echo, repeat what you say. So if you run into patients who you say, "Are you hurting? Are you hurting?" Okay. Or they might repeat their favorite there. She went on a tangent that she absolutely loved Super Mario Bros. The first time, and she was mostly nonverbal. Within the past year, because of what's working with her, she has become a lot more verbal, saying things that she probably shouldn't say, as any 5-year-old. Mind you, she's 5 physically, mentally she's probably about 2.5 to 3. So at this point, unless you're sissy, everybody's mommy or daddy. And she was into Super Mario. Have you ever seen Super Mario Brothers movie that came out? No? Okay. Well, a part of that movie, Bowser, is singing Peaches. Playing the piano, singing Peaches. The first time I had ever heard my child really sing or speak, she was singing Peaches. Peaches, 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 Peaches. To the point where when he's playing the piano down, he goes, "What?" She goes, "What?" And of course, I'm trying to record her to get it. That's when she stops. So I'm like, but as a mom, that warmed my heart because my baby's actually taught. But she will repeat things she hears from movies. So that is another thing that you may run into. And it is a form of stimming. It's not a cookie cutter one size fits all. There's nothing cookie cutter about autism. You're like Supernatural. So knowing the difference between, I try to make this friendly for everybody, all first responders, not just EMS. To know the difference between stimming and somebody under the influence. Because there are certain things, like ways that people stim, that you're like, they're high. They gotta be on something. Because they're just doing this. If you see Joe Blow down the street just doing this, would you think they were like on some really good drugs? I would. Until I learned what stimming was. But knowing the difference, you got me read that. I'm not going to read it to you verbatim. I think y'all can run through that real quick. But know the difference with drugs and alcohol versus someone who is stimming. There's a lot of different things that you can look at. You know, stimming is very repetitive. Somebody under the influence is going to be very erratic and jerky. You know, slurred speech. Where, once again, stimming, you can say the same thing over and over again because it's a fun word to say. Everybody got that? So, some tips and tricks to when you're approaching someone with autism. Remain calm. Because whether it's a medical emergency, a traumatic event, or someone eloped, they're really good about eloping, which means running off without realizing they're running off. So use clear, simple, concise language. We are the world's worst in the South. I still can Kentucky the South, I don't care. About using idioms. It's raining cats and dogs. Someone with autism is very literal. They're not going to know that it's not actually out there raining cats and dogs. I know what you mean. It's raining a lot. It's getting crazy. You ask somebody with autism, hey, grab that chair right there. You know, because they need to sit down. They're going to go grab it. What do you want me to do with it? I need you to sit in this chair right here. It's raining a lot outside. Very clear language. Give them time to process what you're saying to have a response. Their processing takes a little bit longer. You're gonna have to have some patience with these people. You know, whether they're, and I say people because it's not only children, remember? You're gonna have patients that are in their 40s that are autistic that you're gonna have to treat. I say treat like a child, but have that calm demeanor like you would with a child. Okay? And as I always say, they're autistic. They're not stupid. They're very smart. Now, it's the stigma about them being savants. That's not, we'll get to that too. But they're not stupid. They know more than they let on, even if they are nonverbal. Avoid sudden moves. Most of them, they don't like all the motion. It's a sensory issue. You know, so if it's feasible to move slowly, calmly, and reduce anxiety, you know, you gotta establish trust. This person doesn't know yet. And I know I go back and reference my child a lot. Mirabella does not like, it's hit or miss. She doesn't like a lot of crowd, like big crowds. It's overstimulating for her. We took her to the fair and it was an absolute nightmare. The next day, she's sick. She's puking, she's lethargic. This happens when she gets so overstimulated, her body literally has to do a reset. The first time it happened, it scared the shit out of me. She had the ketone smelling, like the acid smelling breath. I thought she had childhood diabetes right there. I went and got a glucometer, got a ketone strip, she had ketones in her urine. Glucose was fine. Because she got so overstimulated, her body just had a dump of everything. And it just made her sick. It takes her days to recover. So establishing trust not to get them anxious. Sure, it may take a little bit longer. But unless it's a life or death we have to leave now, take the extra time to get on their level and figure out what works for them. One of the biggest things is many people with autism, it's not just autism, they have other comorbidities. You have a lot of people with autism that have seizures. They have GI problems, whether it's constipation, diarrhea, constant vomiting. Always keeping that in the back of your mind and using the caregiver, because they're going to know all about this patient. They're going to know what's normal for them, what's not normal for them. Some of them will have specialty equipment. It just depends on, were they born premature? Do they have a feeding tube? I mean, not all autistic patients are like this, but you got to keep in mind, physiology, they are more prone to getting sick. And whether we know why or not, it just happens. So if you have a call out to someone that has autism, keep that in the back of your mind. What other comorbidities will this patient have that I'm going to have to treat or take care of? Because I'm a nerd, I like the physiological differences. Once again, he does behavioral, I do physical. And I don't know if you can actually read that, but it was a really good diagram of some of the differences in brain structure from a person with autism versus somebody without autism. You know, the only thing I didn't have up there was what I told you about the basal ganglia. Verbal versus nonverbal communication. Some of them use sign language. So, can anybody tell me what that sign is for? Thumbs up is for help. So, once again, speech may vary from person to person. Some words here or there, some may not speak at all. I'm not big on the whole understanding nonverbal cues because, once again, half of us don't understand nonverbal cues anyway. And with people with autism, they may be doing something that seems off, but is perfectly normal for them. One of the things with, going back to stemming, you don't want to stop somebody from stemming because that's soothing, unless it's harming themselves or others. There are a lot of autistic patients, especially children, who will bite themselves to the point of almost bleeding. That is one of those corrective. We shouldn't do that because it's actually physically going to hurt them. If it's a stemming, like they're just flapping their hands or repetitive word or even just screaming, that's normal. Let them do it. They have no control over it anyway. So unless it's physically going to hurt them or someone else, let them do it. Utilizing alternative communication tools. Some have communication boards. Some have iPads. We're in the world of technology. Technology is amazing. I know I heard him earlier talking about Spanish and having to talk, stuff like that. Anytime I have somebody that I don't speak the same language, despite my 1,200 days on Duolingo, I'm not going to carry on a full conversation. Like, you want food? Yeah, me too. I pull up Google Translate. Love it. Love that app. We don't speak the same language? Cool. I type it in Google, you read it, now we're cool. Many autistic patients, if they're nonverbal, will have these tablets that they can push and it talks for them. Like I said, they're autistic. They're not stupid. Just because they're not talking doesn't mean they don't understand you. Different resources. We're just kind of talking about that. I created, I don't know if they passed it out yet or not.
I got it right.
Oh, you got them. Okay, never mind. I created communication boards that I felt were more friendly for EMS and patients with autism. It was less busy than most of the ones I've seen online, less cluttered. Back to patients having other comorbidities. Many of your autistic patients will have ADHD or even dyslexia. My 10-year-old, severe ADHD and dyslexia. Unfortunately, that's hereditary. So I'm sorry, honey, you got my worst gene. But the color blue or turquoise, something like that, under the letters actually help people with dyslexia to keep them from flipping or moving or whichever type of dyslexia that you have with just simple lettering. And the letters that I use have just enough curvature that they can distinguish the difference. That's why I use that color. And you can use them for other people besides people with autism. You know, it's pretty easy to just ask them the questions and have a point. You can fill in the rest. There are a bunch of really good communication apps for augmentative alternative communication, which is a little more in depth than, just Google Translate. Because if somebody's actually point at pictures or push something to text, I would highly recommend if y'all have, I know over in Trib we have actual iPad tablets, to get one of those apps to keep on there readily available if you don't want to use laminated copy. Honestly, any kid that I have, I always keep my laptop on me because I'm like, hey, what show did they like to watch? Bluey? Awesome. We're back at Bluey again. God, Bluey is this little Australian Shepherd dog whose parents are amazing.
Don't do it.
I've been tired for 5 years. Really? That's how old I am. You don't say. There's some humor in there for parents. Visual schedules. I'm only incorporating this because many autistic patients, once again, not a cookie cutter one size fits all, want to know what we're doing. From the time they wake up to the time they go to bed. All right, we're going to have breakfast. We're going to change our clothes. We're going to do our schoolwork. We're going to grandma's house, in order. From time to time to time. If you get a patient like that and you're having difficulties because they're like, well, what are we doing this? What are we doing this? Okay, we're going to sit on the cot. I'm going to buckle you up. I'm going to put this on your arm. We're going to take a blood pressure and explain every single step that you're doing. That helps them process. That might even soothe them. Give them some options. Do you want me to use this arm or this arm? Yeah, kind of like we do with anybody else. Give them that sense of control. Not, do you want to do this? No. Kind of give them that closed look. Okay, do you want this one or this one? You're only giving them 2 options. You're winning either way, but it makes them think that it's their choice. Tailored approaches for sensory sensitivities. As first responders, we are really bad about going in and rushing and getting out. It's always been beating our head, load and go, load and go. First thing I thought. If time permits, and they're not in a dangerous situation, figure out what their sensory issues are. We all have them. I guarantee you don't have autism. What's one of your sensory issues that you can't stand? Mine is the sound of sandpaper on wood. Ew. It makes my skin crawl. I can't. No. I have to wear my earbuds, my music cranked, and I love woodworking. If I have to sand something down, it makes my skin crawl. I'm not autistic, but I can't say it's a sensory issue. I don't like it. Anybody else similar? Or am I just the only weird one? Okay, finally, somebody raise your hand. Y'all are alive. I'm amazed. We don't actually have a set protocol for autistic patients. To give you the guidelines on how to approach and treat people. Actually, come up with one of those too, but it's not here. Once again, if it is an emergency situation, you have to get this patient out because the car's on fire and they're losing their shit. Yeah, grab them and get the fuck out of there. I'm sorry this sucks, but it's your life or you're gonna, whatever. We gotta go. However, once you're in the ambulance and things can calm down, try to get on their level again, as we repeated. Involve the caregivers. Once again, like with any other patient with special needs, the caregiver is going to know more about that patient than you are. I don't care what kind of degree you have. They handle them day in, day out. They know they're normal, they're abnormal, that every foul move they've had the last week. Utilize them. Because I can promise you, if it's a situation that they felt they needed 911, they're not going to cause the problems in the back of your ambulance. They're going to be useful in helping you keep that person calm. Because that is something familiar. That is someone familiar. They're going to know what works, what doesn't work, what their sensory issues are, especially if they're nonverbal. They don't like bright lights and loud noises. Cut the lights and sirens. Trust me, I know we are all assholes when it comes to that. When dispatch is like, they request no lights and sirens, look at bed, tell me what to do. We fall down at 3 o'clock in the morning. If I'm awake, you're awake. Whether we actually do it or not, we better talk about shit. We're an EMS. Come on. You know it's true. But most of them do have Sensory issues. Once again, as I'm beating in your head, sensory issues. Food shudder. Some run away from loud noises, bright lights. My child hates loud noises. Something like comes on, she covers her ears immediately. But loves lights, loves bright lights. She'll go fireworks, something bright, flickering, she's all for it. She don't want the sound of it. Other autistic patients love it. They're sensory drawn to it. The louder it is, the more they're like, wow, this is awesome. It just depends on that person. So this one's geared a little more toward our search and rescue people. Can anybody tell me what percentage autistic patients have risk-wise of drowning versus someone who does not have autism? How much more likely they are? 160% more likely to die in a fatal drowning than someone without autism. Autistic patients are drawn to water. I don't know why, but they are. My little one is. I'm outside building a chicken coop. I got a horse trough, which isn't really deep. Uh-huh. But I looked over there and she done stripped down her diaper one leg over getting in the horse trough. Okay. You want to swim? I got it. They don't care how dirty the water is. You can see this mucky sewage swamp stuff. Like, they wouldn't go down there, but they will. And they will play in it like a pig in shit. They don't care. They're having a blast. So, gather critical information about that person. What were they wearing? When's the last time what are they drawn to? You were on a schedule? Okay, what were you doing next? Because it got deviated from what they thought we need to be doing. Right. Next, they were going to go to grandma's house and you got sidetracked doing this. Well, they're walking to grandma's because that's what you said we were doing next. Community engagement, once again, neighbors, people who are actually involved with that child, if they do elope, can help you a lot in knowing what do they like to do? Where are they going to go? Are they going to find a safe space to hide away from noises because you're throwing a birthday party and it's overstimulating for them? Or is there a fair down the street and they hear all that noise and that's what they're going for? Once you find them, once again, support. Check them over. Make sure that they're okay. But the big thing is, with that, search the most dangerous places first and look again. You know, if there's a big body of water, keep somebody there. Hey, stay right here until we find this person in case they come back through and we just happen to miss. Because the first patient I flew out that had autism was a 2-year-old drowning. Daddy's bed was turned for 5 minutes. And he ran outside. He glanced at the pond first. He didn't see her. He was going toward the wood line. And the sub told him to check again. He glanced back. She was floating face down in the pond. This one's emotional for me to talk about because it hits home. But it's also one story I tell in all my CPR classes for the importance of CPR. And I know we're talking about autism, but I'm going to backtrack. And I know we're late. I'm sorry because everybody else was late. But his work made him take a CPR class a couple months before. He said, I was one of those that I was like, I'm never going to do shit. I ain't going to need it. Until he had to pull his daughter out and she limped and blew and he had to do CPR on her. Because once she puked up all that pond water and started crying. And he lived way BFE, hauled ass to the hospital. So we flew her out. She was good. But it was more just because of what happened, we flew her to Vandy. And I'm like, look, man, Scream's breathing. I'm good. Because she was. They're distraught. And I was like, I'm going to take care of your baby just like she's my baby. And I said, I can promise you the moment we take off, she's going to be asleep. Sure does. Take off. She's out. Just passed out. We're going to do like some myths. People thought autistic individuals lack empathy. They don't. They may express it differently, because some of them feel things very deeply. You know, my 5-year-old baby's crying. You okay? Shh. Tell me to be quiet. I didn't make her cry. All autistic individuals are savants, which is like super genius. Also not true. I wish I was. Yeah, that'd be great. They can be very smart, but not all of them are savants. There are a few that do have all those extraordinary abilities, but it's not nearly as common as you think. We've all heard that vaccines cause autism. It does. Another myth. Hey, look at that. Any question? There's never a question.